In the interest of time, let's get started with this presentation. So good evening, everyone, and thank you for joining us for our 2026 Q2 User Summit. In this session, we're going to showcase some of MAPflow's new and upcoming features with a focus on all the updates that have happened since our last summit. My name is Kenny Chong, Director of Clinical Innovation here at MAPflow. Joining me today is Mark Gobrin, Clinical Developer and Growth Strategist. Nardine Nakla, our CEO, is also on the call, but she's not feeling well, so she was unable to present for today. Just as an administrative note, this session will be recorded and posted on our website at a later date. So here is our agenda for this evening. We'll start with a discussion of the recent scope expansion in the Atlantic provinces, particularly in New Brunswick and PEI. Next, we'll look at the upcoming scope expansion within Ontario. And in both cases, we'll review the additional supports that MAPflow has developed to support pharmacists practicing in these provinces. Next, we'll then highlight some new features that have been developed since our last summit, and then as well look at some upcoming features that are coming through the pipeline. And then to wrap up, we'll do a very brief demo of some of the new features in our acute rhinosinusitis algorithm to show how it supports clinical best practices within your pharmacies. Okay. So starting with the recent scope of practice changes in Atlantic Canada, and specifically in New Brunswick and PEI. So in New Brunswick, pharmacists may now independently assess and prescribe for acute bacterial rhinosinusitis, otitis externa, and otitis media. And this expanded scope has been in effect since May 1st, 2026. Note that there are some new skills that pharmacists may need to acquire before assessing some of these conditions. So for otitis media, the assessment includes a physical examination with an otoscope as per the college's practice guidelines. And so there may be some additional training, or there's some mandatory additional training required for pharmacists to be able to perform this in-person practical component, or sorry, in-person assessment of patients. So making sure that they know how to properly use an otoscope through this in-person practical component training. In PEI, an announcement was made just recently in mid-May that pharmacists will be able to assess and prescribe for ear and sinus infections, very similar to what's happening in New Brunswick. This announcement was fairly recent, and so the scope and operational logistics are still being finalized. But we anticipate that this expansion will take place sometime later in 2026. And so at MAPflow, we're monitoring this development very closely to ensure that we will have a solution that's aligned with PEI's regulations and scope of practice once those expansions come into effect. Okay, and so here's a quick overview of what MAPflow is doing to support our Atlantic province users with their expanded scope. We have built or are building out algorithms for acute rhinosinusitis, otitis externa, and otitis media. The acute rhinosinusitis algorithm will launch on July 1st, with otitis externa following later in July and otitis media sometime in August. For acute rhinosinusitis, this algorithm will actually be available in all provinces, regardless of prescribing authority. So in the provinces where antibiotic prescribing is within the scope of practice for pharmacists, that includes New Brunswick, soon to be PEI, but also Nova Scotia and Alberta, the algorithm will enable antibiotic prescribing and provide clinical decision support for managing those patients appropriately with antibiotics. In provinces where pharmacists are not permitted to prescribe antibiotics, The algorithm will still assist with the assessment and symptomatic management of those patients using over-the-counter products. And this is in recognition of the fact that many cases of acute rhinosinusitis do not require antibiotics. So many cases are viral in nature, or even when bacterial infection is suspected, antibiotics are not necessary to achieve optimal outcomes in most patients. And as always, our algorithms are problem specific. So um, regardless of where you're practicing, you could be confident that the assessments align with your scope of practice and any applicable reimbursement criteria within your province. Okay, moving on. Next, we'll discuss the scope of practice changes within Ontario. So there are currently 19 ailments within the minor ailment prescribing program in Ontario. And as of July 1st, 9 additional ailments will be added to that list, bringing the total to 28 ailments. You may recall a while ago, I think about a year and a half ago now, there was an announcement that Ontario would be adding 14 ailments to the minor ailment program. Um, so these ailments have been staged in the release. We're getting 9 new ailments as of July 1st, and 5 more ailments will be coming soon. Here's a quick overview of how or which ailments are within the scope of practice in Ontario. So on the left there, you have the 19 existing ailments. In the center are the 9 ailments being released as of July 1st, and then the 5 under review are on the right. And so the ones we're focusing on for the next week is these in the middle here, calluses and corns, headache, pediculosis, seborrheic dermatitis, tinea corporis, tinea cruris, warts, viral rhinitis, rhinosinusitis, um, and xerophthalmia. Okay, so the Ontario College of Pharmacists had made recommendations for all 14 ailments to be added to the new regulations. But not all of the recommendations are coming into effect, as I had mentioned. So 5 ailments were deferred: herpes zoster, otitis externa, acute pharyngitis, minor sleep disorders, and onychomycosis. And these were deferred because there was some additional discussion needed, either changes to other pieces of legislation, such as labs, or there were some additional education requirements that needed to be established and put in place before expanding scope. Um, and then there was one additional change that was the college had recommended new drugs being added to existing ailments. And the only drug that was on that list was topical roflumilast for the treatment of atopic dermatitis. And so the expansion of these 5 ailments, as well as the addition of the new drug, we are expecting to come into effect soon, although we're not certain of the date, although it should be within, or we should have more information within the coming months. Okay. These slides here outline the ailments and the specific drugs that pharmacists are authorized to prescribe, as set out in the regulations to the Pharmacy Act. And so as a reminder, the drugs that you're allowed to prescribe are dependent on the assessment of the patient's condition. So for example, even though hydrocortisone is listed as an authorized drug for seborrheic dermatitis, if you were to assess a patient for head lice or pediculosis, you would not be allowed to prescribe hydrocortisone for that patient for that condition because it's not part of this list. You could recommend it as an over-the-counter therapy, but it would not count as a prescription for the purposes of billing drug plans. Okay, and this is a continuation of that list with the remaining ailments. Might be worth noting the drugs that are authorized under xerophthalmia. Just there's a lot of them, and I think perhaps difficult to recognize in a generic form, and we'll talk about that in a second. Uh, in addition to the regulatory changes, there have also been updates to the reimbursement criteria as specified in the executive officer communications from the Ministry of Health. So with these new ailments, there are significantly more instances of sharing of billing pins within groups and as well sharing of annual caps. And as an example here, so viral rhinitis is one of our new ailments. When it comes into effect, it will share the same billing pin as allergic rhinitis. And so together, these two ailments have a shared cap of 4 assessments per year. And so there are other categories as well. So in dermatitis, atopic and contact dermatitis were already combined, but now seborrheic dermatitis is being added to that grouping, as well as diaper dermatitis, which was previously had its own billing pins, but it's now being grouped together with the other dermatitises. When the regulations come into effect, calluses and corns and warts will also be grouped together, and then the tinnias will be grouped together as well. And so what this means is that you would not be able to assess a patient for 2 different ailments within the same group on the same day. So if you had a patient who had a contact dermatitis and a seborrheic dermatitis, you wouldn't be able to bill for those assessments together on the same day because they would use the same billing pins. You would also need to be aware of the combined annual maximums for the number of assessments. So these ailments, I mean, just to reinforce the point that these ailments do not have their own individual caps. It's combined with other ailments. So you might reach those annual maximums faster than you might anticipate. This may also influence how often you expect to treat a patient for a particular ailment and how conservatively you want to prescribe, or how liberally you want to prescribe your quantities to make sure that that patient has enough medication to last for until the next assessment. Okay, and to support Ontario pharmacists with this expansion of their minor ailment program, MAPflow has updated and created new algorithms to support the clinical decision making for the assessment of all of these conditions. And so on the left are the algorithms that have been updated to allow pharmacists to prescribe for conditions where previously they were available only as OTC consults. And then on the right are 3 algorithms that are being newly released, the acute rhinosinusitis, xerophthalmia, and warts. These 3 algorithms, we already talked about acute rhinosinusitis, but xerophthalmia and warts will also be made available in other provinces for as OTC consults. So pharmacists can work through the same assessment and clinical decision algorithms that we have for other ailments in the context of these conditions to recommend over-the-counter therapies for patients. Note the asterisks between viral rhinitis and acute rhinosinusitis. So in Ontario's regulations, these 2 conditions are combined, but we've separated them out into distinct algorithms in recognition of the differences in patient assessment and treatment options for these closely related but distinct conditions. Okay. And then, as discussed, it's important to keep track of which medications you're permitted to prescribe for which ailment. And just a reminder that MAPflow handles this all for you. So using the example of xerophthalmia, where there are a lot of medications on our list that pharmacists are allowed to prescribe, MAPflow takes care of identifying what products are available, including brand names that are probably more recognizable, and mapping them to their ingredients, and then determining whether or not that product is actually within your scope to prescribe, or if it should just be a recommendation for that patient as an over-the-counter product. And in this way, MAPflow helps to protect you from in documentation and from an audit perspective to make sure that anything that you're prescribing, you're actually allowed to prescribe, and it's associated with the correct ailment, so that assessment of the patient is linked directly to the prescribing of that agent. And so your documentation is in place and complete to protect you against claim reversals ever in the event of an audit. Okay, so for Ontario users, July 1st is just around the corner, but that doesn't mean you still can't prepare for the coming expansion of scope. So as I had mentioned, several of the algorithms are already available within MAPflow as OTC consults, and you can actually start getting familiar with the algorithms and that process of assessing patients for those conditions now, so that you can get a better understanding of what symptoms you should be looking for and what questions you need to ask patients. And this will help streamline the process for prescribing once the regulations come into effect, and is a great way to identify any gaps in your clinical knowledge before patients start requesting these services, so that you can be prepared, so that you can be fully prepared from day one. As a reminder, your pharmacy has a demo patient within your roster, and so you can practice your assessments using your demo patient, and it won't count towards your pharmacy's official records. So you don't have to worry about things like patient confidentiality and whatnot. It's there explicitly for you to practice with for any assessments. And then once July 1st rolls around, you'll automatically have full access to the new algorithms, plus the new prescription items within the existing algorithms, so that you can practice your full scope right away once the regulations take effect. Okay, and next we'll move on to some other new features within MAPflow that have been released since our last summit. And if you've missed any of these updates from our newsletter or from social media, this is a good opportunity to catch up with what we've been up to and what you can do now within MAPflow. Oops. So the first new feature that I'd like to discuss is prescription renewals. We've created a template within MAPflow to assist pharmacists with prescription renewals, and that's in recognition that pharmacists are not just renewing medications blindly. There's an expectation that that patient is being assessed for their condition, and that the pharmacist is determining whether or not therapy is still appropriate. So the renewal template walks pharmacists through that assessment process to ensure that medications are still indicated, efficacious, safe, and being used properly before prescribing, while automatically documenting the findings. By using this template, that ensures that there's a comprehensive record of the interaction that the pharmacist had with the patient, and the pharmacist's clinical rationale, which allows the pharmacy to contribute it better to supporting continuity of care of that patient and protecting the pharmacy in the event of an audit. To access the renewal template, you can search for renewals in the ailment search bar, or you can find it under the chronic tab to start an assessment for renewals. Okay, the next feature to discuss is custom drugs. This is a useful feature for pharmacies that frequently recommend therapies either that are within their scope of practice to prescribe, but are not yet built out into MAPflow, such as compounds, or if your pharmacy is recommending specific over-the-counter products to patients that you commonly recommend. So if you've been using the other pharmacologic therapy page within the algorithms to enter medications manually, you now have the option to save what you've entered as a custom drug. So in this example here, this pharmacist wants to prescribe a compound, and so has entered in that the drug information as well as typical directions and quantities. And all of that information can be saved as a custom drug so that you can automatically load this information the next time that you do an assessment for this ailment. And so that helps to save you time on repeated entries of the same thing. Once you've created a custom drug, it's saved within your pharmacy for that ailment. And that means that any user within your pharmacy can load it during an assessment for that particular condition. You can also assign the same drug to multiple ailments. I think I have an example here. Yeah. So this is a little bit small to see, but for example, a compound like Betaderm with menthol and camphor can be made accessible during assessments for both atopic dermatitis and for contact dermatitis. So anyone performing an assessment for either of these conditions can access that template and automatically load that drug in. These custom drugs help to ensure consistency in your prescribing. So how you want the prescriptions to be written or to have some consistency within your store. And can also help direct the use of particular medications that you might want to promote within the store, such as over-the-counter products or particular compounds that you make specially within your store. Note that this feature is only available for pharmacies that have a per pharmacy subscription. Hey, and the next feature here is fax to self. So this feature allows you to fax all or any of your documentation that you generated from your assessment directly to the pharmacy's fax number. And the purpose of doing this, if your pharmacy is set up so that your PMS will automatically accept inbound faxes, then those documents can be automatically loaded into your PMS and ready to be attached to your patient records. And so by doing this, it saves you time from having to print out the documentation and scan it back into your PMS, or however else you might be getting it in to your PMS, either downloading it and uploading it manually. So to use this feature from your service summary page, you can select which documents you want to fax, and then there's this new fax to self button here where it will automatically send these documents to the fax number that's been listed for your pharmacy within MAPflow. Note that this feature requires activation of the eFax feature within MAPflow, and this feature is free of charge if you have a per pharmacy subscription. You do need to set it up, which is fairly simple. There's a prompt on the sidebar that walks you how to do that. It is also available for individuals, or sorry, users who are on individual plans at an additional cost, so as an add-on to your individual subscription. Okay. The next update I want to talk about is our new redesigned settings page. So if you're navigating to your personal settings, the layout has been updated to improve navigation. And so hopefully now the settings are organized into clearer sections with an easily navigatable menu. So more of an aesthetic change than anything, but one thing that I do want to note is this new notifications tab. And so we have very recently, this week, released a new feature that pertains to notifications about follow-up assessments. um, and so in Ontario, follow-up is mandatory for all assessments, and in all other provinces, it's considered best practice. And so what this feature does is helps you stay on top of your scheduled follow-ups and ensure that your documentation is complete with respect to your assessments. And then allows you to customize your notifications as well. Um, so there are several different types of notifications that are now available, and you can toggle these on and off as you see fit. So we have day before and date of reminders for follow-up appointments. So if you've scheduled a follow-up appointment with a patient and you've turned on these features, you can get a reminder email the day before that assessment or the day of in the morning to help or to give you a reminder that that assessment is supposed to take place, and to help you with making arrangements within the pharmacy to accommodate that assessment. We also have a weekly follow-up digest that goes out every Monday morning, and likely many of you saw this digest go out this Monday for the first time because this feature was newly released. And so this summary includes any follow-ups that are scheduled for your upcoming week, again, to help you with scheduling and planning your workload around them. And it also provides you a summary of the number of outstanding assessments. And so these are assessments that have been scheduled in the past but have not yet been completed. And so the goal of sending the notification of the outstanding follow-ups is to ensure that somebody is following up on the completion rate of your assessments and ensuring good documentation within your pharmacy to protect you, well, to ensure good clinical care for your patients and ensuring that they're achieving optimal outcomes, but also to protect the pharmacy in the event of an audit. And then there are some immediate reminders. So if you have a per pharmacy subscription, you have the option of sending follow-up questions to patients for them to fill out on their own. And once they've completed that assessment, if there are no issues that have been identified during that follow-up, right now the default is for you to be notified that that patient has completed their follow-up, but otherwise you can turn off the notification if there are no issues. Similarly, if you've subscribed to our incident reporting module, you can be notified immediately once an incident report has been completed within your pharmacy. Okay, and then just to note, this page looks similar but is slightly different. These email notifications or customizations for the notifications are available at both the individual user level and at the pharmacy level. So depending on your workflow, you may want notifications to go to a specific user, such as the pharmacy manager, or you may want it to go to the store's email address. Let's say if you have a shared system for monitoring pharmacy communications. So this is what the settings page will look like from your pharmacy page if you're the admin for your pharmacy. So there's the settings here with the email notifications. Okay, moving along. So this is not a new feature, but given that we are now sending out follow-up reminders and in particular sending out a digest of the number of incomplete follow-ups, this is a good opportunity to remind everyone of the importance of documenting your follow-up encounters to make sure that you're tracking your patient outcomes, but then also documenting the cases where you cannot actually follow up with the patient. So if a patient cannot be reached for follow-up for whatever reason, it's still good practice to document the attempt, and especially important in Ontario where follow-up is mandatory for reimbursement. Um, it is especially prudent for you to document any reasons for not being able to complete that follow-up assessment to protect yourself from claim reversals in the event of an audit. Um, so if you can't follow up with the patient, you can bypass that follow-up assessment. And in order to do that, you can click on this additional menu from your assessment table and click on this option, can't perform follow-up. And it will bring up this window where you can document what happened or the reason why you weren't able to complete follow-up. So some of them, there are some drop-down menu options here, things like the patient is deceased, or the patient moved away where you're just not able to contact them. Or sometimes there's, you're not quite sure what happened, and the more documentation you can provide, the better. As an example here, you might document the times and dates that you had attempted to reach that patient, and what had happened. So you left some messages, they never called you back. At some point, you can only do so much, but it's important to document that rationale. If you don't document anything, it looks like you haven't even made the attempt, and so uh, easy for somebody to audit that and say, you didn't really complete this assessment, or you didn't do your due diligence in following up. Okay, and then again, not a new feature, but as a reminder, if you want to revisit anything that we've discussed today, we have MAPflow Academy available from our main website. So this is from a screenshot of our main website. We have Academy as a link up at the top menu. And the Academy includes clinical resources for continuing education materials on various conditions. And we're continuously adding more resources to our clinical hub to support both our pharmacy users, but also including patient references there as well that you can print off and provide to your patients. There are also how-to guides for how to use MAPflow features. So if you're unsure how to use a particular feature, or you want to learn more about a new feature that you've heard about, the Academy is a great place to start. So you can always browse through the topics on your own, or we do also have an AI assistant. It's this little chat button here at the bottom of the page that you can ask questions to, and it'll automatically search your document library to link you out to any relevant articles based off of your question. So if you're ever looking for information about MAPflow or how to use it, navigate to our Academy and give our AI assistant a try. Okay, I'm going to pause here for a second, and I'm going to hand it off to Mark, who's going to cover this next section.
Hey, thank you, Kenny. So I'm going to be very quick. I'm going to touch on two major upcoming additions to MAPflow, that being Travel Health, as you can see on the screen, and an AI scribe. Both editions are currently in active development with real momentum behind them. That's why we wanted to give all of you guys who are in the call right now a little bit of a small teaser for those features. So if Kenny, you can click to the next slide. Perfect. So travel health has been one of our most requested features since the launch of MAPflow. Pharmacists offering travel health services, whether it's travelers' diarrhea, altitude sickness, any other travel-related conditions, or any travel-related vaccinations, they need a framework that is both compliant and also streamlined. So we're building something that through a medical directive model will that is already established and structured through other approaches in pharmacy practice. So by scanning the QR code on the screen, it will allow you to sign up for development updates as we move through the build. priority access when we're ready to launch, and the potential opportunity to give us input on what the program should look like through your eyes. So I'll give it a few seconds and I'll ask Kenny to click the next slide. Perfect. Thank you, Kenny. So diving into the second major update that's coming to MAPflow, it is going to be the AI scribe. So if Kenny, you go one slide forward. Oh, other way. Perfect. Thank you. The big why behind the feature or why we are developing an AI scribe is filling out documentation is probably the one of the biggest, or if not the biggest, time costs in pharmacy service. So right now, all of you are either typing while you're talking to the patient, or after the patient leaves, you are frantically trying to catch up on all your notes before you forget everything that happened, and neither is really ideal. So an AI scribe is our answer to that. With patient's consent, you record the consultation, the AI then transcribes it and populates the relevant fields within MAPflow. You review it, you make any corrections, and you sign off. So moving on to the next slide. Perfect. So the scribe will work with all consultation types within MAPflow, whether it's a minor ailment, a prescription renewal, or any other modules. And the only thing that is saved by the AI scribe is going to be the transcribed text and the final documentation that you already know and love within MAPflow, that final service summary page. But the audio that is recorded during the transcription is not saved. So for the AI scribe feature, we're anticipating that the AI scribe will launch sometime at the end of Q3 of this year. So stay up to date. If you're not signed up to our newsletter, I'll send that in the chat right now, or navigate to mapflow.ca. You can go sign up for the newsletter there. And then once there's big updates or once there is the launch of that AI scribe, you'll be notified. So that's all from me. I'm going to pass it back to Kenny, who's going to touch on a few more things, and then we're going to let you guys go and relax for the night.
Thanks, Mark. So I'm going to switch gears a little bit now. We're going to look at a very brief demo of our acute rhinosinusitis algorithm, just to highlight some of the features that we've included to help with your clinical decision support making. So bear with me while I switch windows here. I think you can see this fine. Okay, so just a note that this will be done in a pharmacy in New Brunswick, so we'll include decision pathways for prescribing of antibiotics as well. So within one of the important things to note about acute rhinosinusitis is that it actually has a few different assessments that you're doing all at once. So you want to be able to confirm the um, if you're looking at prescribing antibiotics, you want to confirm that it's actually a rhinosinusitis, and then you also want to be able to confirm that it's an acute rhinosinusitis, and then you need to confirm that it's a acute bacterial rhinosinusitis. And then once all those conditions are met, then it may be appropriate to prescribe antibiotics for that patient. Um, so one of the things that we've incorporated is to help with that assessment of um, determining whether or not it is a rhinosinusitis. And so as you click through the patient's symptoms, or as you're recording the patient's symptoms that they're reporting, you may get this message here that based off of what you've selected, these symptoms are not consistent with the definition of acute rhinosinusitis. And that's based off of the PODS criteria. So facial pain or pressure, nasal obstruction, purulent discharge, or reduced smell. And once you've selected enough of those POD symptoms, that message disappears and gives you the go-ahead to continue with the assessment. Okay, so I'm just going to quickly go through some of these. MAPflow will also, based off of your decisions, or sorry, based off of the information that you collect from the patient, um, will also help you determine what it is that you're dealing with. So here, based off of uh, the responses or the signs and symptoms that we've collected, um, this patient's presentation is most consistent with an acute bacterial rhinosinusitis, and in this case, it's a mild to moderate case. Okay. Um, so, because we're dealing with acute bacterial rhinosinusitis and we are a pharmacy in New Brunswick, we can now consider antibiotic therapies. And another feature that we've worked in is looking at strategies for managing antibiotics. So um, even if we determine or suspect that the patient has acute bacterial rhinosinusitis, not all of these patients require antibiotic therapy in order to achieve optimal outcomes. And in some cases, it may be more harmful because of side effects. So, um, so we've also included some guidance on how to um, determine if antibiotic therapy is actually appropriate for that patient and how to manage it. So there are some evidence-based strategies that are available, such as um, starting with a 3-day trial of intranasal corticosteroids or a watchful waiting approach for up to 7 days uh, to help um, delay the onset of antibiotic therapy or to prevent its use altogether in cases where the patient is improving on their own within these waiting periods. Um, and so um, MAPflow has built these best practices directly into our algorithm, not just identifying what you're permitted to prescribe, but providing that support for making good decisions about when antibiotics are actually warranted, and viewing this from an antimicrobial stewardship lens to ensure that on a larger scale, um, we're helping our patients achieve good outcomes, but also preserving the efficacy of our drugs for future generations. Okay, and that's all I wanted to show from our acute rhinosinusitis algorithm. As I mentioned, this algorithm will be released on July 1st for all provinces. So if you're interested, please check that out. You can always practice with your demo patient to preview the algorithm. And then I'm just going to quickly switch back to our presentation just because there's a slide here. Okay, that concludes the actual presentation part, but we'd like to now open it up for any questions that people have. I've also included the QR codes here if you're interested in viewing our academy or signing up for that travel health mailing list that Mark had talked about. And as always, if you ever have any questions or need support as you're going along or using MAPflow, you can always contact our support at support@mapflow.ca. Okay, so at this time, opening it up for questions. Feel free to, um, I'm not sure if chat is active for you, but there should be a Q&A that's active if you can't access the chat, or you can raise your hand and we can try to unmute you if you'd like to speak. Okay, not seeing any questions, um, or any hands up. Okay, well, I'll give it maybe another 30 seconds or so in case people are typing away. But as Nardine has mentioned here, if you think of any questions at a later time, you can always feel free to reach out to us at support@mapflow.ca. Okay, you're very welcome, and thank you for posting in the chat so that I know that it's working. Okay, well, I think we'll wrap it up there then. Again, if you think of any questions, feel free to reach out to us by email. We're happy to address um, anything, any questions, any concerns, any requests for features. We love to hear from our users to make sure that we are continuing to develop a product that is meeting the needs of our user base. Yeah, thank you everyone for your time today and for joining us this evening. And we'll be in touch soon.